Good morning, friends. The topic which has been allotted to me is mental health issues among physicians. I am Dr. Sandeep Grover from PGI Chandigarh. And before I start my talk, I would like to disclose that I do not have any conflict of interest while presenting this talk. And I have used some of the images available on the internet to convey the messages which are relevant to the persons who are pursuing medicine. So, entry medical education is very, very competitive, and it's one of the most difficult professional courses across the globe. There's no doubt about that. And the training is very, very long and tedious. If you spend about 5 years in MBBS and then internship and then a post graduation and then further senior residency and so forth, and maybe then super specialization. So the whole journey can vary from about 6 years to about 15 years, which is a very, very long and tedious process. And the whole journey is very, very stressful, and there's a lot of peer pressure within the profession and across the profession to perform. And as I've said, there's need to do the post graduation. Somebody who's just doing MBBS in today's world has no future possibly. And when you do so much of education and then you start your practice or start your job, the job is still very stressful. There is always a fear about mistakes and errors, and this can sometimes be very, very costly and sometimes irreversible. They can cause death of the person. So you have to be very, very cautious in whatever you're doing, how you're working. So that again brings a lot of stress. And we all work in a hostile job environment, like inadequate infrastructure, unavailable or the absolute equipments, which is a well-known fact in various government medical setups, where we'll see that infrastructure is not up to the mark and you have no control over the equipment which you have. So all this will again bring in different kind of pressure on you. You want to do your professional work, but the infrastructure is not supporting you. And in certain government jobs, you go through the delay in promotions. Then in the private practice, there's a lot of competitiveness, and there's always a competition to move ahead of each other. And if you want to set up your own private practice or your hospital, it is very, very costly affair. So the other aspects which come in are the long working hours, poor work-life balance, because you have to work for long hours, you have to work in the odd hours, get up in the night to do surgeries or the procedures. So again, the work-life balance gets disrupted, and there's a whole culture of hire and fire, especially in the corporate sector. So if you are not toeing to the corporate structure, you can be fired anytime. And when you're running your own clinic, either or in the government setup, there's always a risk of facing violence from the public, patient, and their caregivers who do not understand what has been done for their patient, and any death is considered as it has occurred because of the negligence of the doctor. So, with all this at one side, still the public and the world expects doctors to have these kind of characteristics, that they have to be emotionally stable, honest, and everything. And besides everything, they have to provide genuine care to the ill people and have empathy. That's something that you're going through all kind of this stress, but you cannot express yourself, and you have to maintain your composure. That brings in again a different kind of stress. So when we look at this, it's not that the doctors or the physicians go through poor mental health, but they also go through poor physical health, and they experience a lot of early mortality. Data from IMA only suggests that the age of death of doctors is much earlier compared to the general population, the mean age. So that's where we are standing today. So what are the mental health consequences of so much of going through that rigmarole of training, practice, and so forth? It manifests as stress, anxiety, depression, burnout, suicide, substance use disorders, or something like marital failure. Now, stress can be understood as a broad kind of a column which is experienced by almost everyone. And the anxiety could be related to a single procedure or can be short lasting in people. May not be everybody doesn't go through a syndromal anxiety disorder. But the most studied among all this is the burnout, which has been understood in relation to the physicians. So the burnout is understood as a persistent negative work-related state of mind in normal individual. This is very, very important to understand. When I say that, means every one of us goes through this. That is primarily characterized by exhaustion, which is accompanied by distress, a sense of reduced effectiveness, decreased motivation, and development of dysfunctional attitudes and behaviors at work. Or simply putting, burnout basically is defined as an erosion of human soul. That in short, the person who is charged with the caring for people is himself not happy. Now, there are three basic components of burnout, that is the emotional exhaustion, depersonalization, and sense of low personal accomplishment. And all these three will lead to decreased efficacy or the effectiveness at work. The emotional exhaustion is understood as the physician himself or herself is physically and emotionally drained, or they have their emotional and physical energy as very, very low, and it is in the downward spiral. And the common thought which goes through the mind of the physician is that I'm not sure how long I can carry on with this, and how long I can keep going like this. So there's always a dilemma going on in the mind. And the depersonalization is understood as by the characteristics of cynicism, sarcasm, and the need to vent out about one's job or the profession and so forth. This is basically understood as the compassion fatigue. And the simpler way to understand that, although you're caring for your patient, but emotionally you're not available for your patient or anyone else to that matter, and your emotional energy is trapped, you're just working like in a mechanical fashion, not able to interact or not able to emotionally connect with anybody. And the cynicism is that the clinicians lose the ability to care, empathize, and connect with the patient, staff, or their co-workers. And they may even blame, shame, or demoralize the very people they are likely to, or they are expected to care for. And later on, they will feel guilty about what they are doing. So this is something which almost all physicians go through, and this lack of efficacy, that the person starts doubting the meaning of meaning and the quality of their work, and they may have frequent questions that what's the use? My work does not really serve a purpose in any way. They may end up worrying about that they will make mistakes if things don't get better soon, and they will begin to doubt that whether their work is really making any difference to anybody or not. And how common are the mental health issues? So, as I said, the burnout is the most commonly studied mental health aspect of the physician. So, it is understood that about 50% of the physicians experience burnout, and the data from US suggests that over the years, that is the data which examined burnout in physicians from 2011 to 14, it was reported that there was about 10% increment in the burnout rates among the physicians. And the study further suggests about 54% of the doctors say that they are burnt out, and 88% of the doctors say they are moderately or severely stressed out. And the important thing, about 60% of physicians say that they will not recommend a career of medicine to their children. So that itself is a big indicator that what kind of stress they go through. And in terms of comparison with the general public, again, if you look at the data here, the physician burnout rates are about 10% higher than that seen with other professions or the general US adult population, and the dissatisfaction with the work is again significantly higher among the physicians. And in terms of the career phase, the burnout rates again are those in the early first 10 years of their career. They have lower satisfaction with overall career choice. They have higher frequency of work-home conflicts and higher rate of depersonalization. Whereas the middle career population report that they work for more longer hours and they take more overnight calls. They have lower satisfaction with the specialty in which they are working, and they have poor work-life balance, and the higher rates of emotional exhaustion and burnout is seen. So depersonalization is most common seen in the early phase, whereas the middle phase is more of an emotional exhaustion. And in terms of different outcomes, if you look at that, in the early and the middle, men report higher rates of burnout compared to women, whereas in the late phase, women report higher rates of burnout compared to men. And in terms of different settings, again, the primary care setting, physicians report higher rates of burnout compared to the other specialties. People working in medicine and surgical specialties report lesser of burnout compared to the primary care physicians. So that needs to be noted. And in terms of the comparison between the various kind of practice, again, the private practitioners report more burnout compared to those who are in the academic setting. In terms of various specialties, if you look at that, the level of dissatisfaction is significantly higher in neurosurgeon compared to that among the other specialists. Whereas in terms of burnout rates, if you see that although the the physicians working in emergency medicine have reported highest level of burnout, but their satisfaction is still much better. If you look at the worst combination, something emerges like urology, where the satisfaction rates are also lower and the burnout rates are also higher. Same goes for family medicine, something like general internal medicine, orthopedic, radiology. So these are the specialties where the satisfaction is lower and the burnout rates are higher. When we come to the Indian data, one of the study in which we conducted at our institute, severe burnout was reported in about 1/6 of the participant, and the very severe burnout was reported by the 1/6 participant, and another 1/7 reported the severe burnout, and about half of them were at the risk of burnout. So overall, the burnout rates may be close to about 70% or 75%. The burnout rates are higher among the residents compared to the faculty, and the higher burnout rates were associated with poor doctor-patient interaction, that is shouting at the patients, feeling of having poor communication skills. So that's where we need to understand. And the other studies which have been done across the India, which have evaluated burnout or stress in different forms by different scales, suggest that again, they have varied in how they have tried to define burnout or the stress. Overall, studies, the range has varied from something like 5% to about 87% now. That's again similar, or if you look at our studies, close to the some amount of burnout is about 90%. So you can understand that burnout rates and stress rates are very, very higher among the medical professionals. And in terms of what are the factors associated with the burnout and stress in Indian studies, there's no difference between the medical and surgical specialties, but the other factors which are associated with burnout include the higher workload, lower recreational activities, verbal and the physical abuse by the patient or the caregivers, lack of empathy from the seniors. Residents report higher burnout compared to the faculty, and other the environmental factors like unsatisfactory hostels, inadequate library facilities, frequent examination all contribute to the burnout and stress. And overall, we can say that the burnout rates and the stress rates in Indian studies are significantly higher than that reported for the European doctors. And it is being suggested that being in private practice gives professionals more control over their job style, which may prevent a burnout. But again, we do not have significant data for that perspective. And in general, as I said, compared to the Western population, the burnout rates are higher in India because of the worst doctor-patient relationship, and that. But this, although they have higher rates of burnout, they still keep on working. And in terms of various significant mental disorders, the prevalence of depression across different studies have been reported to be about 8% to about 30%. Same for anxiety disorder, it has varied from 10% to about 40%, with a mean of about 25%. And suicide rates are again reported to be higher compared to the general population. The suicide rates reported in or the suicidal behavior reported in physicians is about 16%, and substance use disorders are about 5 times higher than the general population. And the suicide rates are significantly higher in women physicians compared to the men. What are the risk factors for stress and burnout in physicians? So younger age, being of female gender, having marital issues, long working hours, lower level of job satisfaction, sleep deprivation means taking night calls, higher level of work-life conflict, and work interrupted by the personal concerns or higher level of anger, loneliness, anxiety, or the stress in the work relationship all contribute to the poor mental health. The other choices, like something like specialty of choice which you are working, may contribute to that. The workload, I have already mentioned that documentation, administration, which may be more issues for people at the residency level, again contribute to a lot of poor mental health. And similarly, dealing with patients who are more demanding, talk about their entitlement, adherence, compliance to the issues, will again bring in a lot of stress. Similarly, working in an academic or non-academic setting or inpatient outpatient setting will depend on the patient load, how you are dealing with, and if you are experiencing a lot of sleep deprivation, it can again contribute to a lot of stress and burnout. And people, those who have a personality like workaholics or who are more masochistic, that they want to do things for others, ultimately, because of in their zeal of doing things, they end up damaging themselves. And the other causes include loss of meaning in medicine and patient care gradually, that when you have decreased support from other people around, there's increased responsibility, and you are not given an autonomy and flexibility to decide about things. So basically, you are a slave, have to work where the system wants you to work. That again leads to poor mental health. And when you do not get support from your peers, or there is lack of professionalism among the peers, or the leadership does not support you, again there is a more poor mental health in physician. And of course, work life balance is an important aspect there. And the other aspect specifically related to the medicine, which again lead to a lot of mental health stress, is if you're working in palliative care, critical care, or oncology, where you are required to take decisions in a split of a second, or where you encounter death day in and day out, again your chances of having poor mental health increases. With that, despite making all efforts, you're not able to save your patients. And if you have internal defenses, that where you always question yourself about any small thing which goes wrong, or when you don't have external support, again you have a lot of mental health issues. And again, same goes for the malpractice suit, that you are always worried about malpractice, and there's a hostile environment around, again then you'll have a lot of poor mental health issues. So if you do not have too much of support, and basically administration does not support the medical person who is working in the environment, and basically it is the medical person who is supporting the administration, then there are more chances of poor mental health. So any kind of conflicts, demands, poor resources, poor rewards, and lack of fairness. These are the five broad things, if you want to remember, which contributes to poor mental health. And what could be the consequences? The consequence of poor mental health could be the lower patient satisfaction, the quality of care you provide to your patients, higher rates of medical errors and the malpractice risk, and higher physician and staff turnover, that you will keep on frequently making job changes, and poor job satisfaction and absenteeism from work, friction in the personal relationship, and isolation from one's significant others and the family members. And what could be the signs? The signs and symptoms can vary from exhaustion, depression, anxiety, substance use, relationship issues, anger, and poor satisfaction. So the whole gamut of things can reflect signs of stress in physicians. So basically, the feeling of professional inadequacy and ineffectiveness, or there could be a lot of lack of motivation, feeling helpless, or there's a lot of cynicism coming in, withdrawal from responsibility, isolating from others, or procrastinating the work, that can again contribute to, or can be a manifestation of signs and symptoms of burnout. The 7 early signs of stress or burnout include the disappearing act, that person stops answering call, or stops coming to the work, or there is low work rate, that is the person's efficiency goes down, there is frequent loss of temper, the patient appears to be rigid, that he cannot tolerate some any kind of deviance, or there's a lot of bypass syndrome, that the junior colleagues or nurses find way to avoid seeking the doctor's opinion or help, and there is career problem, that difficulty with exams and so forth, and there is insight failure, that if you try to give some kind of constructive criticism or constructive advice to the person, he does not prepare to take. So if these 6-7 things are happening, these basically indicate that the person is stressed and requires help. So, but despite all this, most of the physicians do not seek help. And the reasons which are being said is the lack of time, and they prefer for self-management, themselves try to treat themselves, which is a very, very wrong attitude, and lack of convenience access, that they are not able to reach to the mental health professionals, and they are often worried about the confidentiality issues, stigma, and in the early career students, there's the issue of cost and belief that the treatment is not going to work. And if you look at the data coming from India, also a study which was done in Pondicherry, again, which evaluated that barriers to seeking help for mental health and the physical health, which again showed that similar kind of features like lack of time, fear of unwanted intervention, unsure whether whether they need to seek help or not, confidentiality issues, stigma, cost, fear of side effects, and impact on the academic performance were the major reasons why people don't seek help. So all these are actually unfounded, and these need to be changed, where we need to work on that so that the barriers can be reduced. The study which we did again, the most of the residents did not seek help. Basically, again, that the basic reason was the stigma, and they may be labeled as weak and having a mental illness by their colleagues, or they may be accused of shrugging away their work responsibilities, and it may impact the attitude of the faculty towards them and the time constraints. So we need to develop measures so that we can help clinicians by understanding these barriers, so that the healthcare facilities can be modified in such a way that they can seek help. How we can prevent poor mental health? So this can be done at the individual level, the organization, an individual interface, or at the interface level. So if we look at the individual level, basically we need to reduce our stress level and produce and improve the ability to recharge. So that basically requires learning to have a work-life balance, and starting the day with a relaxing ritual, adopting healthy eating, exercising, setting the boundaries about the work and the personal life, taking daily breaks from the technology, nourishing your creative side, that do something which you enjoy, like, and learn how to manage stress. Then it's important that we need to free ourselves from the workaholic condition, and one of the best defenses to do what you like, and rather than the work you just keep on doing, and fight for the balance in all what you do, and strive for the following important thing, that is the meaning, purpose, and worth it. So that just don't keep on running after the work. And the other important issues include taking care of self, that cultivating personal interest and self-awareness, professional help whenever you require that, give due importance to your relationships at all levels, at your family, at the workplace. You should have a good attitude towards your work, that you need to find meaning towards the work which you are doing, rather than doing that in the form of like a clerk, and have control over your schedule. Don't try to procrastinate work, or neither try to prolong your work, and always have a positive outlook towards the life, and follow spiritual practices if you do not have any conflict with that. And you need to build your resilience by always having the realistic appraisal about things, and doing things in the right way. So that's where you need to improve your resilience. And factors which can promote resilience include that you use positive coping, have always be happy, have positive thinking, have realistic understanding, and try to have control over your work, and be physically fit, and have some amount of altruism. So similarly, at the family level, you take family support. At the organization level, you modify, and at the community levels, you try to develop out of cohesion, connectedness, and a collective efficacy. At the organization level, we need to promote the physician's autonomy, that they are able to influence the work environment and schedule the control over that, rather than the so-called administration deciding about what they want to do. And we need to provide adequate support services like nursing, secretarial, administrative, social work, and ancillary staff, because most of these works actually take a lot of time of the physicians, and they actually do things which are not required for them to do, or which can be done by people who are less qualified, and we can save a lot of good time of the physicians, so that can be meaningfully utilized. Again, relationship issues needs to be kept in mind, and medical profession core values should be kept at the organization level, rather than just running after money, or the cut practices and other things needs to be kept out. At the organization level also, that we minimize the homework interference, that the so-called the physicians can have time for their child care, and they can schedule their work environment, work timings, and so forth. That can again promote the so-called good mental health for physicians. And we always give them the breaks, like vacation time, limiting overtime, and establishing mentorship, and considering periodic sabbatical. All this can help in improving mental health of the physicians. And we need to have positive work engagement. That's basically that we provide flexible working hours for the persons, and protecting them from the exposure of occupational hazards and enhancing job security and childcare. I've already mentioned, and again, maternity and paternity leaves can be considered. And then at the organization level, avoidance of inappropriate allocation of work to the physician that can contribute to burnout, and we need to provide the supportive and collaborative care. And at the encourage governments and regulator to address the so-called regulatory burden, like all the laws coming in, so that those could be modified. And in terms of engagements, interventions, if somebody has mental health issues, again, these can be done at the individual level, at the organization level, and at the organization interface level. Basically, these involve that improving the awareness of the people, and need to have designated time for reflection groups or debriefing protocols where people can sit and discuss what kind of stress they are facing, and teaching practical skills like mindfulness, CBT, exercise, or the building communities like mentoring and coaching programs, which can again help people to take care of self. And we need to again ensure access to care, that we need to screen people for burnout, depression from time to time, and define a clear system for referrals to the mental health services, and provide in-house mental health services for physicians, and develop walk-in well-being centers which can work for 24 hours, something like a crisis helpline or phone helplines. This can always help the physician, that they know that somebody is available to listen to them. This all can ensure access to care. A lot of peer support is again important. Talking to each other, asking well-being about the other person often helps. And we need to improve the workplace environment, that review the workload and schedule with the physicians, their inputs, the autonomy and the flexibility, and adequate staffing to reduce the administrative or the clerical work given to the physicians, and they can optimally work at the level which is more meaningful. And at the institutional level, organization level, we need to transform the institutional culture as a sense of community. There should be open communication with the leadership to plan for the staff retention, and there should be a culture of wellness in the workplace, that there's a sense of open communication, and we need to support for the personal resilience. At the individual level, proper rest and exercise, spending time with the family, having a personal physicians to assess well-being objectively, and setting limits on working hours, and choosing certain types of medical practices, and being positive and maintaining a balance of life is important. And stress management techniques of whatever kind a person wants to pursue can be done. And seeking help from mental health professional whenever somebody is going through stress, avoiding substance use, and taking the prescribed medications regularly, and accepting the patient role for themselves, again, is a very, very important aspect. To conclude, poor mental health outcomes are common among physicians. Often they do not seek help, and there is need to develop programs for regular screening. And it is important to understand that prevention is better than cure. So we need to think about more of preventive measures. We need to emphasize on avoidance of substance use and accepting the patient role. Thank you.